watching us safe and at home. Here in New York, the current American epicenter of this pandemic, the first data tonight suggesting that maybe, just maybe, social distancing is helping to slow the onslaught of coronavirus. And yet officials say the worst days are still to come. The numbers are still rising, leaving the region's medical system on the edge of being overwhelmed, and other cities fearing they may very well be next. We've got it all covered. Miguel Almaguer starts us off.
As our country faces a national emergency and scenes like these unfold in communities big and small, tonight New York State says it's the canary in the coal mine. Once bustling city streets have become eerily quiet, while lines outside hospitals stretch around the block. Makeshift morgues are being prepared. The governor says in 3 weeks, coronavirus cases will hit their high point.
We still have the trajectory going up, 80% still self-resolved. About 15% of the people who test positive require hospitalization.
While the explosion of new cases in New York are slowing, the city's high density and residents leaving town could exacerbate the spread. Police are warning residents to avoid crowds. Some city streets will be closed to traffic so pedestrians can spread out. Across the country in California, where half as many tests have been taken than New York, the death toll and those infected could easily become the highest in the nation.
We are anywhere from about 6 to 12 days behind what we are seeing in New York City.
Even in our country's most remote state, Hawaii, there is trouble in paradise as new cases skyrocket. More than half the nation has orders for residents to stay home. But some governors, like Florida's, will not issue a state mandate.
To order someone not to be able to earn a paycheck, that is something that I think is inappropriate.
But the World Health Organization says staying at home is vital.